menace of drugs continues to threaten families and especially the youths in our households. Illicit brews, which remain very persistent, and it is a danger even to our health. Therefore, it is important to note that the Ministry of Health has picked this with a lot of concern. And the key messaging that we want to tell the people is that tobacco is actually the gateway substance, which is often used by the youths, introducing to alcohol, bang, and many other hard drugs. Tobacco Control or Tobacco Control Act of 2007, in its regulations, prohibits smoking in public places. And this is something that I would want enhanced by bar owners, restaurants, and public places. A restriction of advertisement, promotion and sponsorship of tobacco products, and it mandates clear health warnings. So wale watu wako na bars na restaurants, and in the first place, mambo ya mashule watu wawache kuvutia tobacco karibu ama kuweka clubs karibu na mashule because of the children who are growing. Therefore, and also advertisement. We have seen, and with a lot of concern, that in the local areas you will find shisha bottles just placed on the tables, and it has gone up to mashinani. I want to state categorically that shisha remains banned in Kenya. We have not backtracked on that. The cigarettes, e-cigarettes with flavors are also not acceptable in the country. Today we have met with the clergy, and my ask is to tell them that tobacco is the gateway to other drugs. It is the gateway to even bang, it is the gateway to cocaine, it is the gateway to alcohol, and it is important to note that it is a silent killer and destroyer in health matters. And it also depends our poverty levels. Because if one young man or the man of the house, the lady of the house, the first thing they do in the morning is to go to a beer den, then you expect even the economic status of that family will go down. So it undermines God's dignity and God's creation. And that is what we have agreed with the teams that we have met today. My key messaging around this is that we have zero tolerance for tobacco in homes, and schools and parents must not smoke around their children. That is paramount. You know, secondary smoking is the one that causes even more harm. It is more dangerous. So kama wewe ni mvuta wa sigara, si uende na huko chini kwa mashamba yako ama kwa mto uende ukavutie huko, lakini usivutie karibu na watoto wadogo. Na pia karibu na kanisa, karibu na mashule, we want to have zero tolerance. And I want to ask the public health officers across the country to enforce this, because we have enough public health officers in this country who are able, and they are trained, and they have all the requisite information and tools to go and enforce. I also want to tell the youths that tobacco is very, very addictive. It is expensive, it is deadly. If you look at one electric cigar today, it will cost you not less than 3,000 shillings. How many youths will afford 3,000 shillings at any given time to get the puffs that they want? So they'll end up stealing.